I think a lot of people think that I want to be a dentist, that I'm taking patients away from my doctor, that I'm trying to do their work.
But I always tell people, would you rather have a doctor who's in the room with you and is trying to get out of there as soon as possible because they have 3 or 4 other things they need to do? Or would you rather have a restorative hygienist who's been trained, who's had practice, who's being coached up and checked by the doctor?
No one wants to be doing a bad job if they're delegated a task. So you can get even more bang for your buck with those team members.
So what would you say to a dentist who is nervous to delegate more in their practice?
If you let them know that you want to help them and you're not trying to take things from them, you're gonna get a lot further.
One of the most underrated things we have done in our practice is utilize restorative hygiene. Not because it lets the doctor do less, the doctor's trying to be lazy, but because it lets the whole team operate at a higher level. So Kolbi, when people hear restorative hygienists, what do you think they misunderstand?
I think a lot of people think that I want to be a dentist, that I'm taking patients away from my doctor, that I'm trying to do their work. But really what we're trying to do is create more opportunities for patient care, free up the doctor's schedule a little bit, and let everybody be a little bit less stressed out about timing.
Yeah, I think one of the things that oftentimes people will think of as, well, if a hygienist is doing the fillings or the restorative, then it must not be as good as the doctor. And my rebuttal to that is always, well, sure, there's a bit of a learning curve, right? When you first started, there was things we had to redo or revamp or tweak. But I always tell people, would you rather have a doctor who's in the room with you and is trying to get out of there as soon as possible because they have 3 or 4 other things they need to do? Or would you rather have a restorative hygienist who's been trained, who's had practice, who's being coached up and checked by the doctor, who's going to have 45 minutes to an hour of isolated time with you? And in my opinion, I think that actually can be significantly better for the patient. So I think this whole not as good misconception is a myth. Now, when it comes to restorative hygiene, scope varies state by state, training and licensure. So this is not a blanket statement for every practice everywhere. But where it is allowed and done well, restorative hygiene can be a huge unlock. So let's dive into that. For us, restorative hygiene has not just been about placing fillings. It's really been about trust, delegation, efficiency, and giving a highly skilled provider a bigger clinical role. Kolbi can explain what restorative hygiene means in her work, why she enjoys it, and how it changes her relationship to the practice. So Kolbi, tell us what it means to you to be a restorative hygienist in our practice.
Being a restorative hygienist gives me the opportunity to do things outside of just hygiene. It gives me schedule flexibility. I'm able to be artistic, is my favorite thing. It has helped me grow as a provider a lot. I've learned so many things about restorative and honestly myself as a hygienist.
So Kolbi, how does restorative hygiene create more capacity in the schedule?
Restorative is a very meticulous process, and every time you have to sit down and do a class 2 filling, you should be taking a little bit more time on that because it does have a huge effect on the long-term outcome of that restoration and for your patient's health. So if you can delegate some of that time to a hygienist who is fully seated with that patient for an hour or more, why wouldn't you?
So what would you say to a dentist who is nervous to delegate more in their practice?
I think you have to think long term. What does delegation do for you as an owner, as a doctor? You're able to do things that are higher value, procedures that only you are able to do. You're building trust in your team, which helps them feel more empowered to stay and do an even better job. No one wants to be doing a bad job if they're delegated a task. So you can get even more bang for your buck with those team members.
One of the things I talk about a lot is, investing, not just investing in things like stocks or bonds or real estate, things that people think about all the time, but really investing in yourself, right? Gaining more skills, better communication, and then investing in people, And so I think for doctors who are afraid to delegate, it's like, well, you have to see it as an investment, right? So the first few times you did fillings in our office, it probably wasn't as good as if I would have done them. And there's been some, there's some we had to redo or I had to kind of give you some tips. But now I don't have to do any fillings in my office. I can only focus on the things that I really love to do and that provide the best value for our patients. And on the flip side, most of these patients are getting diagnosed for restorative through the hygiene column anyway. So one of the lines we say all the time is like, well, hey, if you like hanging out with Kolbi, good news, you get to hang out with her even more when you come back for your fillings. So It's going to be a great time, So I think investing in your team is a really important way to think of it as a long-term investment as opposed to, if I let them do this one thing, I'm going to end up having to redo it in the short term. I had to learn that delegation is not lowering the standard. Done correctly, delegation is how you protect the standard. Restorative hygiene has helped us create more clinical capacity in our office without making the practice feel like an assembly line. It also gave Kolbi a bigger leadership lane, which matters because, like Kolbi said, people want to grow. That's almost more important than their pay. So if you're a dentist, the question is not just, how do I produce more? The better question is, am I fully utilizing the talent that's already existing inside my practice? So Kolbi, what is your advice for hygienists who want to be seen as more than just doing prophys and even want to start to dip into doing restorative procedures in their practice?
The way that you present it to your doctor is the most important thing about trying to change from just a prophy mill to a leader in production. You have to let them know that you're going to be helping them create more time for the procedures that they actually love to do and get more face time with their patients. If you let them know that you want to help them and you're not trying to take things from them, you're going to get a lot further.
If you're a hygienist who would like to expand their ability to do more procedures and even get into restorative hygiene like me and Kolbi do in our practice, please share this with a dentist who really needs to think bigger about what hygienists can do. Start the conversation. Please comment on the video. Me and Kolbi would love to engage with you and talk about how we do things in our practice. But overall, thank you so much for tuning in. If you get value out of videos like this, please like and subscribe as we're putting video content out every single week. Thanks for tuning in. See you next time.